Does everyone have ADHD?
We all have characteristics, but that does not mean we meet clinical criteria for the diagnosis.
But we meet.
So first of all, what is it that you have? Because there are 3 different forms.
Okay.
So there's hyperactive impulsive presentation.
Wait, hyperactive impulsive.
And what does that look like?
That looks like you are always on the go, Energizer Bunny. You keep going and going and going. You talk nonstop. You're doing 15 different projects. You are moving from one topic to the next. You're running when you should be walking. If you're a little kid, you're climbing when it's dangerous to climb.
Mm-hmm.
You're just acting before you think. But what you will find is that people with ADHD tend to be a little bit louder. They tend to move their bodies more. Mm. Then you have the inattentive presentation, which is like space cadets. You are forgetting things. You're losing things. You're drifting off into space. You're supposed to be focused on one task. And before you know it, like a bunny runs across your path. And then the third is the combination of all 3.
Oh, the big boss.
All 2, the big boss, which is where in some settings, you're hyperactive impulsive. In those same settings, you might be inattentive. And this is when you see people really start to struggle. And you have to have disruption in social and occupational functioning. What that means is this has to be negatively impacting your relationships, or it has to be causing trouble on your job occupationally, right? If you're a kid, you don't have a job, you have school. Mm-hmm. So what you see is difficulty like getting through a test or forgetting to turn the homework in even though you did the homework.
Right.
The house is organized, but if you open a drawer or you open the closet, it looks like
it's chaos.
Chaos.